Welcome everyone to our webinar, Fall Prevention Month 2019 Activity Implementation Webinar with an activity spotlight on spot the hazards that can lead to a fall, facilitated by the Fall Prevention Community of Practice. My name is Mariel Ang and I am the project coordinator at the Ontario Neurotrauma Foundation. ONF sponsors Fall Prevention Month and the Fall Prevention Communities of Practice's online platforms Loop and Loop Junior. Before we begin, I'd like to give you a rundown on the Zoom meeting platform. Your screen may look a little bit different depending on the type of computer you are using. If your Zoom application is opened in full screen, you can double-click or press the escape button on your keyboard to exit the full screen. There should also be a button on the top right corner that says Exit Full Screen. On this slide, you can see that I've circled in red where the Exit Full Screen button can be found. The webinar technology consists of two parts, audio and visual. Both visuals and audio are provided through your computer monitor and speakers. To test your audio settings, look for the Audio Settings or Join Audio button in the bottom left corner of your screen. This will provide options for testing your computer microphone and speakers. To adjust your audio settings, click the Audio Settings button on the bottom left corner. If you look at the center of your screen, you will see the following buttons that allow you to access the chat box, raise hand, and Q&A features on Zoom. The chat box allows you to send messages to the webinar presenters. You will only be able to see chats sent by the panelists. You can use the raise hand button if you want the presenter to connect with you through the chat box. You can also submit questions through the Q&A box. You will only be able to view the questions you have asked, not questions posed by other participants. During the Q&A sessions, we will be reading the questions aloud to the group and they will be answered over the audio line by the presenters. If you need to leave the webinar at any time, click the red Leave Meeting button in the bottom right corner of your screen. If you have any questions about the technology during the presentation, please type them into the chat box or use the Q&A feature. Alternatively, you can email me at mariel@onf.org and I'll work with you to resolve technical issues as soon as possible. The webinar is being recorded and a YouTube link will be sent out to all participants in about 1 week along with the presentation slides. This slide provides the webinar outline for today. I'll start by giving you a walkthrough of the updated Fall Prevention Month website and welcome questions from the audience. I'll then introduce Daphne Kemp, who will be presenting her spotlight activity. If you have any topic-related questions during the presentation, please type them into the chat box. During the Q&A, the questions will be read aloud to the group. I will now be navigating to my browser where I will be providing a walkthrough of the updated Fall Prevention Month website. So everybody should be able to see my screen now. I'm using a Chrome browser and this is the Fall Prevention Month homepage. You'll see at the very top of the homepage, we have a section for adults and a section for children. If we scroll down, you'll be able to see our main call to action message in regards to Fall Prevention Month and some popular resources at the bottom here. If we continue to scroll down the screen, you'll be able to see links to our communities of practice. And this is really where you can be involved in preventing falls all year long by joining Loop and Loop Junior. If you haven't heard of Loop or Loop Junior before, feel free to navigate onto our website and click on these logos and they will navigate you to our communities of practice. And from here, we're going to scroll back up to the top and we're going to take a look at our main menu bar at the top of our screen. So if you see here, we have a search box and this is going to search every page on the Fall Prevention Month website. And so I will provide a demonstration of that shortly. Under About, you can read a little bit more about the campaign. You can read about how you can get involved. Our mailing list refers to our newsletter. So I highly recommend that everybody signs up for updates. We'll be sending emails every week or so leading up to the campaign and then more regularly throughout the month of November, highlighting some different tools and resources that you can find on our website and how you can use them for what you would like to do during November for Fall Prevention Month. If you would like to get in contact with us, you can click the contact button and you will see our contact information here. We also welcome you to stay connected. We're very active on social media throughout November, so please follow and retweet us on Twitter and follow and like and share our Facebook page. from here, we're going to take a little bit more of a look at the different components of our Fall Prevention Month campaign, being the adults side of the campaign and the children's side. So if you are working with older adults, or if you are planning an activity or an event for older adults, or for your staff who might be working with older adults, you can navigate to our to the adult section of our campaign. And from here, we've divided the website into two sections. The additional resource side, and you can read a little bit of a description of it here as well, provides you with resources on a variety of topics related to fall prevention. This is really a place where we have resources from other organizations, so they link outside of the Fall Prevention Month website. And if we click the View Resources button, we'll be able to see that you can find information for older adults and caregivers, practitioner resources, statistics and infographics. So for example, if I click on practitioner resources, you'll be able to see that it's further broken down into different categories. So here are a variety of guides, guidelines, and reports. We can continue to scroll down, and here are some portals and different communities of practices and resource centers. And finally, some programs. Again, these all link to external websites, and we would like you to know that this is by no means an extensive inventory of Fall Prevention Month resources. We try to keep them very high level and identify evidence-based resources that could be helpful during Fall Prevention Month. You'll note that as you navigate through the site, you will see up here what is called breadcrumbs. So it will show you exactly where you are on the website. So you can see that right now I'm under adults, additional resources for adults, practitioner resources. If I would like to navigate back to our adults page, I would just click on the adults page here, and it'll bring me back to my home page for the adults campaign. For those who are looking for different activities or promotional materials, we house these under the Take Action section. So we're going to click View Resources. And from here, there's, again, another description of the two categories. Promotional resources is where you can find different resources to promote the Fall Prevention Month campaign, or resources where to help you create your own content. So for example, if you are hosting an event and you would like to create a poster, you can use this template, which will help you build your own poster. We have a fact bank where you can pull some Fall Prevention Month stats and use them in your content, etc. And this is where we also have some external tips on promoting Fall Prevention Month in the media. So I'm going to navigate back to my Take Action section of the adult campaign and look at ideas for activities. And so this is where you can find sample activities that you can host for Fall Prevention Month. Again, they are also categorized by various categories. So we have active living, activities that you can host for your professionals and for your staff, for continuing education, promotion and awareness of Fall Prevention Month, and social activities and games that you can conduct either with your staff or with older adults that relate to fall prevention. And so from here, I'm going to actually navigate to, under education activities for professionals and staff, spot the hazards in a room that can lead to falls. And this is actually the activity that Daphne will be discussing with us very shortly. Please note it's available in English and French. And so before we allow Daphne to discuss her activity, I'm going to welcome any questions from our participants. So if you have a question, feel free to click on the Q&A box on Zoom, or you can also type your question into the chat box. And while we wait for your questions, I'm just going to pull up this slide again, and I'm going to be introducing our presenter, Daphne. So Daphne has worked in her current role since 2011. She's a regional resource and health educator providing support across the continuum of care. Daphne chairs and is a member of an extensive list of fall reduction advisory committees and has been instrumental in the implementation of numerous fall prevention projects, programs, and resources that exist today. She's a partnering member for the Fall Prevention Month, with a focus on activities within the website and is the Saskatchewan representative for the Fall Prevention Committee of Practice. Her roles vary from participating in fall prevention research, critical incidents reviews, education to staff, students, families, and communities, as well as resource development, strategic planning, and policy development. Her goal is to empower others on the implementation of a safety culture that embeds fall prevention into everything we do based in best practice while balancing dignity of risk and client-centered care. And so I'm not seeing any questions as of yet in regards to the Fall Prevention Month website. I still welcome participants of the webinar to submit any questions that they might have in terms of the navigation. And I can address them at the end of Daphne's presentation. So without further ado, please take it away, Daphne. I'll remind you to unmute your line, and I will navigate your slides.
You betcha, thank you. So welcome everybody to this introduction series highlighting the toolkit and now more specifically an activity. I've been a part of Fall Prevention Month for a few years now, and I've uploaded and implemented many of the activities on here. This one, however, is one of my favorites. That is, well, basically because it's a pretty basic concept that you can use, adapt, expand on, and make it suit your needs and environment. It was really effective here in Saskatoon area for raising awareness and engaging others in taking action to prevent falls, since we all have a role to play. The examples that I will be sharing are from experiences last year that we had here in former SHR as part of the Saskatchewan Health Authority in both acute care and long-term care settings. And I wanted to give a shout out to Parkridge Centre in Saskatoon for allowing me to share their creative rendition of this mock environmental hazards room experience. So I hope that this gives you guys some useful tips and ideas on how that you can experience this activity as well. New slide. Go ahead, Mariel. So logistically, there are some important things that you need to consider. Firstly, who are you going to collaborate with and partner with to make this happen? Do you have a fall prevention team or a group of colleagues that can help support this? Do you have a volunteer base that maybe can help? It's great to have a mix of disciplines and different backgrounds that can help contribute. However, I recognize that we do our best to make things happen with what we have. We collaborated with nursing students in our acute care location, and this worked awesome for setup, promotion of the activity, and as well as engagement. We did have a small committee that we divided up some of the tasks to make it more manageable. And it's really at this point that you need to understand who is going to support the planning so that you can determine the scope of the event and delve deeper into such things as location, capacity, size of the event, and timing. You then need to decide, is this going to be a standalone thing that does not require anybody to monitor it, that's maybe open 24/7 to anybody and everyone, or is this going to be just a couple hours in a day or more ongoing a few times in a week? Whatever you decide, you'll need to make sure that you have the manpower for the setup, the sustainability for the duration, and then again for the takedown. Next slide. So in saying that, you also have to understand that this activity is really about raising awareness of risk factors and engagement for everyone. So we decided early on in the acute location to have it open. The more the merrier. At Parkridge Centre, it was geared to staff as a means to engage them in a hands-on type of way. So it can be geared to the public as well in the community if you have the means to do so. The more that we can get the public to understand the risks of the environment and to recognize their inherent risk factors, the better for prevention of all ages. Next slide, please. So location is a big consideration. It is something that I'm working on and hope to expand in our Saskatoon area because the feedback that we had was so positive. Logistically, things that we need to consider is the use of the space. So can people access the area easily? In our location last year, it was somewhat hidden. It was off the beaten path because our choices were somewhat limited. So then we needed to consider how are we going to get people there. So we had it in a nursing education room, and it was far away, but it was a perfect spot in regards to space. So things when we were considering that was it a safe location? We didn't want to create false risk by having it too small, and we were conscious that if many people came at once, we wouldn't be able to accommodate. So we had to ensure that we were mitigating risk. So we had to consider, the space and clutter. Could people get by and maneuver easily if they had walk aids? That it wasn't in a busy location, so there was not too much going on. And we also had to ensure that there was things like ample lighting, that there wasn't opportunity for doors to be too heavy to close on people, because we have had some of those things happen at events previously. We also did learn that minimizing the noise level made a big difference for the attendees that were from the public, just as well as for interaction. We considered if there was more opportunity for some interaction, and that was part of that consideration, is could there be some one-on-one time or some facilitated time for questions and information and additional learnings? And then was there space for resources and displays to be set out? This led our group to consider how many can go through at one time. Do we set it up to be open, or people can go through just leisurely, or should we have it more focused and facilitated? We experienced it both ways, and both are effective. So it's entirely up to you how you guys want to do it. We did get great feedback because of the facilitation piece, because it provided opportunity for sharing and stories. In the long-term care home, the room was set up and there was a question and answers with an answer key. And this was perfect too, especially when it can't be manned and when you want to have it open for a longer stretch of time. So I did like the experience of having a person to sort of set the stage. It worked really good for groups going through it one time. It provided me an opportunity to point things out when people weren't understanding the clues or the risks. We had some engineers go through, and one happened to be an engineer whose mother had experienced a fall. We had housekeeping, we had administrators, we had administrative staff, we had patients, families, you name it. It was such a broad experience of so many different people, and that's really what we had wanted. We're now considering other spaces, such as PT departments, rehab settings, maybe a vacant seniors apartment or a room in a personal care home. If you have access to furniture, a space could be sectioned off in like a community setting such as a mall, and you could have outline some hazards of a room in a home that way. So really, you just have to be creative. Next slide, please. So when we were also thinking about location, we were struggling with timing and the things that we needed to consider for that. So it really does depend on the location. You really want to get more bang for your buck. So things to consider is, is it a day of the week that things are on? So are you competing with anything? Is it on a weekend or a Monday when maybe staff are gone, but it may provide opportunity for more public to attend? Is there potentially a more busy day of the week or time of day in the area that you might set this up at? In the community, there were certainly times of days when we recognized that people get out more, which for us has typically been in the morning, and then people stop coming. It starts trickling off in the afternoon. So can you do this at a time when there's going to be more people present, or perhaps pair it with something different, another activity, and have this as an adjunct? We wanted to reach staff at a couple times in the day, for example, shift change in our acute location, because we could only get the space for a day. At Parkridge Center, they had the opportunity to run it over several days so that they could reach many different shifts, which was also a great way to have more people attend. Next slide, please. So cost, of course, setup and cost. Cost is always a huge issue for us because really I don't have access to additional funds. So it had to be really low cost or no cost for us. This does take a little bit more creativity and those partners in that collaboration. So any kind of promotion that there might be, it could cost money, and there's also cost of printing if you don't have access. I certainly searched out ways to find free advertisement in some of the free papers and on our website. I posted the events. So really, it really did not cost me anything, but it was really targeted. We used local resources that I did print, and I used some of the prints from the toolkit. But you can print as much or as little as you need, and it really can be kept to a minimum. Where we did spend a bit of money was on food, because everyone loves food. I know that Parkridge had a great idea, and they provided ice cream to those staff that completed it. We provided a fall prevention cake, and the students in acute care cut up the fall prevention cake, and it was provided in the promotion of how we advertised and made the announcements to engage people to come. So many people came on their lunch breaks or coffee breaks, and because they knew that there was going to be food there. Another cost that we had was in regards to prizes for participating. And so we did get some donations, and we provided TIM cards for those that filled out the questionnaire. But you can also get some of those donations provided as well. So the last thing for cost really is setup of props and what you'll use to stage the room. We created a list, and we used what each of us on the committee had from our work and from our home. So really, we didn't incur any expense on that, but you know, it depends what environment that you'll be in. Next slide, please. So what you'll need, again, it will really depend on the scope of your event and the environment and where you plan to do this and what risk factors you really want to highlight. Yeah, if you don't have something, this picture I found quite cute from Parkridge Center. You know, they created a coffee spill. So, you know, that was a pretty creative, non-costly way to make a risk factor. But some other ideas to get you started might consist of, we got some empty pill bottles donated from a pharmacy. We got some old glasses donated from some of our family members. We had walking aids that were, you know, old, sort of broken from some of the old therapy departments. We brought slippery sheets. We brought floppy carpets. There's toys, cords, improper clothes, and improper footwear. So in the community, you know, just to add into that, you know, some stepping stools and some ladders, some corded tools to point out those type of hazards as well. Next slide, please. We took it one step further also in both of our areas, and we decided to make it more meaningful by creating a sit-in area. So this is just an example of what we did here. You can certainly adapt that to your own area. It did add an extra element so for the staff to really have to think about what that person's risk factors are. We did provide some of the assessments that they use, such as TLR, and we did, you know, add in some extra inherent biological risks just to get people thinking about, you know, were they wearing hearing aids? What kind of medications were they on? Were they hydrated? What was the bed height at? You know, was there bed rails? What kind of clothing? And then Parkridge actually added in an answer key so that they could actually check their answers when they didn't have somebody to facilitate it. As I said earlier, I was there to be able to sort of give some prompts to get people really thinking. Next slide. So the reason why we did the scenario as well is we really wanted people to understand it's about the person in the environment, and we wanted people to tie in the links of how the risk factors interact. So, you know, having a bedside table that's far away from the bed, and having the bed up, or having the glasses on the nightstand so that they aren't actually wearing them. Next slide, please. Some other suggested ideas in the clinical area I just put on here. At the end, I would love to hear from any of you in regards to additional ideas that you guys may have that we can all build upon this activity for this year. But yeah, like some of them that I had mentioned earlier, the bed at an awkward height, you know, even the wrong type of mobility equipment for that person. brakes not on, etc. Next slide. How you would do it in the community setting would not be much different. There certainly are some risk factors that are unique. You know, using some pet toys. This is a picture of my grandma's living room when she was alive. And, you know, she certainly had hazards within her living room, such as the scatter rugs and the toys and cords and things that need to be definitely put at a different level where she could reach them, so that you can reduce them getting on those step ladders. So again, love to hear your ideas for the home setting as well. Next slide, please. So this is just an example that I wanted to provide of some of the questions that we did ask on the sheet that people could fill out. You really can adapt these questions and use examples for your area that you're working in, but it really did provide thought and conversation in regards to what people's ideas were. So I do feel it's a good idea to have something that you can provide that makes them actually think about what they're looking at. Next slide. I loved this idea. So this idea came from Parkridge Center in a form of engaging their staff, is that they created a fall scene investigation, CSI-like, and it really did spur people to come and intrigue and getting people to participate. So it just puts a fun spin on getting staff and people involved. I know that they had staff from all over the building that attended their event too, with some pretty good success. So, you know, be creative and try implementing some of these extras. Next slide, please. So another addition that we did in the acute setting is we added to the experience by allowing people to experience different risk factors. And we do have this as part of the toolkit. So, you know, it gave people a different lens of experiencing that room. So providing them ideas that simulate different risk factors. So we provided goggles that could show different eye impairments, such as cataracts, diabetic retinopathy, and they could see the room from their eyes. You could also provide like hearing blockers or earbuds with distorted sounds, or provide painful feet by putting some rocks in your shoes, whatever else that you can come up with, and have them, you know, go through it once with their lens and then try to give them a different experience if time permits, just to take it one step further. Next slide. So the other thing that you can add in is just provide, you know, additional resources. It's always great to pair an activity with something else. So this was one of the printable displays from Fall Prevention Month last year that was provided on the toolkit. And so that was up on the wall. You can also do it in display form as well, and just have resources and opportunities for people to you know, take some things away. There is some great activities in the toolkit, you know, word searches, word scrambles that you can provide to intrigue people more in understanding risk factors. So print a few off if it's feasible, and you can add that into your environment. Next slide, please. The promotion piece, I did talk a little bit. We did circulate posters in advance. We had them in elevators, on units. We had them in a newsletter. And I did personally circulate to managers and directors, at least in, you know, a health region setting. But certainly you can promote it, you know, in your channels. We did promote over the intercom. And like I said, the food thing works. We had to provide very clear instructions on how to get to our location in the acute care setting, and we did have student porters that would provide the cake and literally walk people and guide them to the room since it was out of the way. So really it's about a combination of promotion, word of mouth, signage, and engaging personally. I did email a bunch of people that we were hosting that weren't part of the health region, just to try to add in that we had engagement from the community and patients and families as well, because we want to make sure that we have those things. as part of the promotion, we did promote that we were going to have prizes. And so that was one thing that we did do that helps as well. I didn't add this in here, but I do think it's really important, lastly, to add that we did do a short evaluation from those that participated. And it was interesting because all of the evaluations were very, very positive that we should do it again. But I did have one response that did find, think it would be valuable if I provided more tips on what the general public could do to prevent falls. So yes, we showed the risks, but we should have added and considered providing some posters or some information on tips. So I definitely took that into consideration and will certainly try to add something more around that element this year. And so now, yeah, I'm going to open it up and would love to hear from you about your ideas or any suggestions and any questions that you may have. But thanks so much for listening.
Thank you so much, Daphne, for your presentation. We're opening it right now to all participants to submit any questions. You can use the Q&A feature on Zoom. It should be in the bottom center of your screen or at the top at the black menu bar. You should be able to see the Q&A option. Feel free to type in your question there, or you can also use the webinar chat box to type your question. I will read them aloud, and then Daphne or myself can answer the question. I'm just going to go back quickly to our Fall Prevention Month website because I want to take a look at Daphne's activity on the website so everybody can see what they're actually going to get when they come on here. And Daphne, I just see a question has just popped up in the chat. How much have the falls decreased after the campaign? What are the statistics before and after? So I'm not sure, Deborah, if this is a question for Daphne or for the Fall Prevention Month campaign itself, but that, unfortunately, that information is not possible for us to capture. We have annual reports that pretty much report on our activities throughout the campaign. So if you navigate under About and click on Fall Prevention Month, you'll be able to see some information about our mission and vision. And sorry, it's not actually under Fall Prevention Month, it's on previous campaigns. So you'll be able to see our annual reports throughout the years, and we've highlighted some major accomplishments right underneath if you don't want to read the full report. But we report on different web analytics, so the reach of our campaign. But in terms of looking at actual falls, because it's a national campaign, that's not very feasible for us, unfortunately. I hope that answers your question, Deborah. If you have, if you'd like to elaborate, you can feel free to type in the chat box or in the Q&A again. Another question has come into the Q&A. How are we measuring the effectiveness of these measures? And that's a really great question. The campaign is pretty young. We've only been around for, I think, this is our 5th year. But in terms of the effectiveness, we've been trying a couple of different things. In the past, if some of you recall, we did have a calendar, so we would actually try and report on the actual initiatives and activities that people are doing in the month of November and in around the month of November to prevent falls. We've also tried to collect qualitative data through focus groups, so actually interviewing people who are hosting activities to see exactly what they're doing and what kind of impact they've had within their communities. Deborah has elaborated, I think this is for you, Daphne. Have you encouraged specific equipment, high-low beds, seating devices, etc.?
Mara, can you read it just to me one more time? Sorry.
Sure. Have you encouraged specific equipment? And I think she's providing examples when she says high-low beds, seating devices.
It was much more generic than that, and I think that was one of the feedback that was provided, was that we need to provide more in relation to what things we should be using. You know, we were pointing out in this one, the activities that were risky versus providing so that people were aware of the risks. We didn't add on, how to make it better. I certainly talked about those things when I facilitated, but in order for takeaways for people to take, we provided the resources that they could see and feel, but we didn't actually take it the one step further and provide a whole bunch of literature on, styles of bed, best equipment to use. No, we didn't do that. Also, it's very individualized as well. So we ended up, I think we had at the one location, we had something like 147 people throughout the day. So it was larger than we had first anticipated to sort of be more specific in regards to tools. Did that answer your question?
Yes, I believe so, as Deborah has said. Thank you. So I believe that has. Thank you, Daphne. Abiola has asked, how can you reduce risk of falls at night among dementia population? I think that question is for you, Daphne.
Yeah, no, that's for sure. So a few things, and I certainly, don't have all the answers to that, but, you can actually get things like, and it would be more specific in regards to the person, of course, but things like night lights, you can get glow tape to guide, spaces so that people can see. I'm not sure what your location is like, but it also really does depend on the person and in their environment and what their risk factors would be at night, if they're sundowning, if they have hydration issues or toileting issues. So it would be more specific in regards to the person, but we certainly do, know that there's perceptual type difficulties at night and challenges with lighting. And so you need to make sure that people can actually see and do that when they do get up at night. So I hope that answers your question, but I could more specifically talk to you about, additional risk factors for people if you want to have that conversation offline.
Great, thank you, Daphne. I just want to ask Helen Gagne, who is one of our panelists, would she like to speak?
Okay,
Oh, there you go.
Yeah, I just did the unmute. As Daphne mentioned, I was just about to mention that there is, for those of you who are in the area of Oakville, there is a presentation that's happening on the topic of lightening the way to independence using appropriate lights for better sleep activity cycle and falls prevention for individuals living with dementia. So we could provide that link after if you are interested, and we'll probably post it on Loop as well. So it was just in line with Daphne's answer. Thank you.
Helen, is that only open for Ontario area?
So it seems to be a face-to-face situation. I don't see a means of recording this event, which is unfortunate. And what I'm thinking of at this point, if that is the case, it might be a person that we want to do a webinar on this very topic.
Absolutely. Thank you.
Send the link.
Perfect. Thank you, Helen. If you could find the link and send it through the webinar chat to all participants, everybody will be able to see it and will be able to access the link.
Great. Will do.
Great. We did have another question about fall prevention posters and if those are accessible on the website. We are still working to upload all of our promotional materials on the site. So if you can see on my page here, I've navigated under adult promotional materials, and here you'll see the branded media package, and if we scroll down here, this will have this has a lot of other promotional materials. You'll see that there's a postcard that you can use to either print or share digitally in 2 different sizes. The poster is still being finalized, so this is our old poster from last year, but I'll just show to you as an example. So it was available in a Word document, and it's just a very basic poster that you can edit, and you can add your own local resources or statistics about, and then it has our fall prevention month website. So I hope that answers that question. An anonymous question has come in, and I believe this one is for you, Daphne, again. Side rails are often seen as a restraint and thus eliminated from beds. When doing AM care, turning the patient could put the patient at risk, in my opinion. It also doesn't allow a patient to be an active participant in their care, i.e. helping them to turn, feeling safe when bed is elevated from AM care, etc. Your thoughts on this broad rule regarding no bed rails?
Okay, well, that's not really to do with the topic today. However, bed rails is something that's very, very individual, and I think it's based on that person's assessment. There are tools out there that can allow you to understand, you know, the harm versus the benefit of the rails, and it sounds like you've indicated that this person might use those for turning and positioning. However, there are cases where people go over bed rails, get entrapped in bed rails, and actually have very harmful incidences from rails themselves. So looking at the person and understanding if the rails are harmful or beneficial. And in many cases, the rails can cause more harm, but of course you would want to have them in place if the person actually uses them and requires them and actually has been part of the conversation that wants them. Many people actually feel claustrophobic with rails, and it also is very different on the setting. So there may be different considerations from an acute care setting versus a long-term care setting. For the fact that in acute care, people are going through something acutely ill and they may have some sort of acute challenge. And a long-term care home, it's their home. And we need to take those things into consideration, as well as what safety measures are in place. So is there opportunity to have a very, very low bed that the person has a fall mat on the floor and in place and could not harm by coming out of the bed? So if you want access to the pathway that we use here, please message me offline and I will share that with you.
Great, thank you, Daphne. I see that there's another question on a similar topic about bed rails on the chat box. And I would just like to say that these questions, as Daphne has mentioned, is not directly related to the topic of this webinar, but you are more than welcome to go on to Loop, because I know we have a number of different discussions that have existed on this topic precisely. And you can also look into our Knowledge Center to find additional resources if you're looking for some of the research around that topic. One thing I would like to navigate to on our website is Daphne's activity, and this is where you can find it. And so you'll notice that there is a bit of a description here, and I just wanted to show everybody what they would get when they actually download the activity. So you'll see that there are instructions. It's not as detailed as how Daphne has explained it for this webinar, but we will have the webinar recording and her slides available on the page, on this Fall Prevention Month page as well. But it does have some pretty brief instructions so that anybody could print this out, read it, and implement the activity. She has suggested ideas for different settings. She just suggests you can even take pictures. We do have some examples here with some of the images that Daphne has shown in her presentation today. There is another question in the Q&A, asking if fall prevention posters can be available on the website. And we do have some. As I mentioned, our promotional materials are still in the works. However, if you are looking to host an event and you would like to create your own poster to put it within your setting, you can use this build your own event poster. So if I click here, and if you're working with adults, you can click this, and this will actually download a Word document. And once you open it up here, you'll see that you are able to edit the document. But it does provide a really nice, colorful, engaging template with the image here. And this is where you can actually edit your event name, the date and time, the event location, and you can edit everything here. You can even put your logo in there. So that's just one resource that we have on our website that can help you advertise your activity. Frances asked, will all resources and information be available in both English and French? That's a great question. We have select resources that are available in English and French. We do try and translate as much of the promotional materials that we create as we can in French. However, most of the activities are submitted to us by others who have conducted the same activity for Fall Prevention Month. So unfortunately, due to some funding constraints, we can't translate absolutely everything. If you are looking for to access the website in French, you can do so here, and you will see that the activities will be will only show you the ones that are available in French. Okay, so I am being aware of the time. It is 12:45 right now. I wanted to thank Daphne for sharing all of her information about her really great activity and really walking us through step by step and providing everybody with some additional information and you know, trying to get creative with how to implement this activity. They were really, really great, some really great ideas that she provided. And so I also just wanted to promote some of our future webinars that will be happening next month as well. On July 9th, we'll be hearing from Amber Sheik and Marguerite Thomas on safe winter walking. And on Thursday, July 16th, we'll be hearing from a very similar activity geared towards parents and children. I will be pasting where you can register for the webinars in the chat box, so you should be able to see that there. You can click those links to register if you would like to listen into those webinars as well. I will also be providing the same walkthrough for the website at the start of the webinar. So if you have any questions about the website, you can also ask during those webinars as well. Thank you very much to everybody who participated. Thank you again to Daphne for presenting. Please don't close your browser just yet. Once this webinar is done, you'll be redirected to a Zoom page and invited to participate in a short survey. You'll please click the blue continue button on your browser and you'll be redirected to our brief webinar evaluation survey. We always appreciate it if you could provide us feedback so we can continue to offer high quality webinars like the one you just experienced. Thank you all and have a wonderful day. See you next time.